Well, good morning, everyone. It's so good to see so many familiar names that I know here. My name is Laverna Whitcup, if you don't know me. And we've got Dawn Mcconnell here today. I'll be introducing her in just a little bit. But I just wanted to say welcome. Thank you so much for tapping into these webinars. This is the absolute best way that we know to get everything out to you guys as far as what the changes are, and we specifically do these with Priority Health plan changes because we have hundreds and hundreds of people on these plans, and we really want to get this message out of what the changes are. As you well know, COVID has changed this a lot. We used to do these seminars live in person, but now we're going to go forward with doing them as webinars because of this whole COVID stuff. I just hate it. Like I'm sure a lot of you would do, but I'm thanking God for technology too, so I can at least get the message out to you. And again, the purpose of the meeting today is to go through the Priority Health Plan changes. So the one thing that I always want you to know is that if you are already on one of these Priority Health plans, you do not have to do anything if you want to keep your plan. It just automatically rolls over. The only thing you want to be aware of as we go through this presentation is, do I want to change my plan? And if you want to change your plan, we've got it. We now know that we can't change your plan for you. However, we will give you step-by-step instructions on how to do this. It has been very evident that they don't want us to do plan changes any longer. So anyway, we will make it as easy as possible for you. So we are here to assist with that, but again, we can't do them for you any longer. So with that being all said, I'm going to introduce Dawn Mcconnell to you. Dawn started with us back in March. I tell you, she is like my right arm now in this whole business. I really appreciate her and her expertise. She comes very well educated in the Medicare world. And she's also going to go through some housekeeping things for our webinar today. Take it away, Dawn.
All right, thanks, Laverna. Yeah, so welcome. I'll hit some housekeeping items here with us first, and then I'll give you a little bit of my background here. I'm trying to multitask as people are still coming into the lobby. So, but during this webinar, you probably saw a banner at the top of your screen that said we're recording this session. So I just wanted to let you know that we are recording. We are going to keep your microphones off and your video is off, just to reduce any distraction throughout this session. At the end of the webinar, we're going to have a time to do some questions and answers. So if you see at the top of your screen, there's a little chat bubble, like the old cartoon chat bubbles there. If you click on that chat bubble, it will open up the chat bar. And throughout the webinar, if a question comes to mind, you can just write your question into that chat bar. And then at the end of the session, we'll take some time to review all of that and answer your questions the best we can. People are still coming in. Boy, we've got a bunch of people today. This is great.
That's awesome.
My ADD is kicking in though. So let me introduce myself. For those of you who don't know, my name is Dawn Mcconnell. And for those of you who worked with Jim Mcdonnell, okay, again, ADD, I got chats coming in. For those of you who worked with Jim Mcdonnell, for those of you who don't know, he retired at the end of 2020. And so I came in on March 1st of this year, and I've had the privilege of caring for Jim's clients and hoping to continue that really good care that you're used to from Jim. And then also I was hired to be Laverna's right hand extension there, and I get to assist her on just the managing her client accounts. So Laverna and I have a very, very much of a team approach as we look at all of that's to be done here at Ford. Yeah, it has been such a pleasure to be here. It feels like I've been here for much longer than just a few months. To give you a little bit of my background, I worked in the hospital for about 15 years as a respiratory therapist, and then made the shift into this health insurance. So I've got a pretty rounded view of health insurance, and it's just been great. It's been great. I love working at Ford. I love working with Laverna, and I'm just getting really excited to meet all of you. And unfortunately, it's a little bit more video in these times, but it's been a pleasure to talk with you on the phone and meet more and more of you as the time goes on. So with that, I'll turn it back over to you, Laverna, and we'll get going.
Okay, so yes, that makes me officially the old timer in this department at Ford Insurance and working with the Medicare and everything.
That's right.
Thanks a lot, Dawn. And since Jim Mcconnell retired, but again, we are here to help you, and I'm excited to be able to work with Dawn. So anyway, so can you see my screen okay now, Dawn? Okay, got it. I'm always learning this technology stuff, so I got it all set up for you. So this first slide that I'm going to show you. Okay, this might not mean anything to you, but it means a lot to me as an agent in this business. So what this is it's a nationwide Medicare Advantage snapshot, like it says. And what it's doing is showing us the trend of what is going on with Medicare Advantage programs. Now, I'm sure all of you, if not most of you, have seen these annoying commercials on TV about all the Medicare benefits that you deserve. So this is what we're talking about, is Medicare Advantage programs. And you can see where it started out in 2000, and then it just kept on creeping up there to where it's at in 2020 here, or 2021. And so these plans are becoming more and more popular, as you are probably well aware of that. The way I feel about these plans now is that I just feel like we are in the right place at the right time. And Priority Health as a company in Michigan is at the right place at the right time. I really appreciate this company and how they operate in our state. There's things that I have probably told a lot of you before, if I've ever met with you on Medicare Advantage plans, is that it's a fact that Priority Health in Michigan, more people choose Priority Health over any other company. And there's probably about 12 companies in Michigan that offer Medicare Advantage plans. Their doctor network is second to none. And the other third and probably the most important reason why I like this company is because I know that you can go to any Medicare doctor in the United States, and that is your network. So those are three things that I really like to stress with this company, of what I know that is going on out there with the companies in Michigan. So yes, Medicare Advantage is booming, and I see that these companies are constantly adding more and more products as time goes on. So again, that's why we have a lot of people in Priority Health, is because of the things that I have stressed already. And back to those TV commercials, I really want to caution you with those, because, I know we hear things about the give back benefit. I get this question all the time. What is that? Well, you have to be in a certain zip code to get that. And I know that up here in northern Michigan, it's not very available. And I've seen some of the plans that offer that with other carriers, and they're pretty stripped down. I mean, it's not something that I would recommend any of my clients to do unless that, well, just bottom line, I would not recommend you to do those benefits at this time. But it doesn't mean that down the road, Priority Health might come out with something like that. So as time goes on, we'll find that out. But again, back to that big give back benefit, you have to be kind of destitute to get that kind of a program. So anyway, so that's the answer to that question. And then the other thing with those TV ads is that you do need to be careful with what company you're with. So like I said before about Priority Health, they've got, more people choose Priority Health in Michigan. They've got the outstanding doctor network, second to none in Michigan here. And then you can use any Medicare doctor in the United States. If you follow those TV commercials and sign up with a plan, you might be getting a plan that you don't don't even work in your area. I just had a customer yesterday that actually she did sign up for one of those plans inadvertently, and she found out that they wouldn't return her phone calls and the customer service was terrible. So anyway, we hope that you will stick with what you've got and know that you're with an excellent company in the state of Michigan. So again, that's what this whole slide tells me, is that we are in the right place at the right time with these Medicare Advantage plans.
Laverna, if I could interrupt just
Yep.
shortly here, if you can just adjust your camera a little bit so we can see all of
Is that
your
better?
face. Perfect.
Is that
Thank you.
okay? Thank you. Okay. So my screen is tiny compared to my slide presentation over here on the left of me. So where was I at? Okay, you will have in-network coverage with any Medicare participating provider across the nation and outside of Michigan. I've already said that. Again, I want to stress that you can use any Medicare doctor throughout the United States as your in-network coverage. And again, this is the only company that I know of that does it this way. And unlimited emergency and urgent care across the world, anywhere in the world. And you've got an amazing Assist America program to go along with that. You will have also have in-network coverage with every major hospital system in Michigan. You do not need referrals for any of your care. So just be aware that you can self-refer to any physician that you decide that you want to work with. Now, there's going to be some changes that we go through on these slides, and we're going to go through it plan by plan, and we're going to name these plans by their names, okay? So the key plan is the one that the Priority Health really put a lot of money into this year, and it's pretty awesome what they did. So on the key plan, you will now have more embedded comprehensive dental benefits. You will, and incidentally, embedded, when we say embedded, what that means is it's automatically in your plan. It's already in there, and so you don't have to do anything extra to get these benefits. So the first thing is the 50% coinsurance on your fillings, okay, and crown repairs, 50% coinsurance on non-surgical simple extractions, and there's no limit on fillings, for example, of how much the insurance will pay at the 50-50. As a result, you will have nearly 40% premium reduction on your optional enhanced dental and vision package. Now, you've probably, if you're on this plan, you have probably already gotten your annual notice of change and seen that the premium went down on the dental and vision. So that's a good thing. So, and also on the key plan, and I've had lots of questions on it, this insulin-dependent diabetics will now have insulin coverage through the coverage gap. So if you are insulin dependent, I won't spend a lot of time on this right now, but if you have questions on this, always let us know. But basically what it means is that if you hit the coverage gap or donut hole, as some people call it, in the prescription drug program of your Medicare plan, now you will pay just the straight copay of what you had been paying before through that coverage gap. So that is a bonus for anyone that needs insulin-dependent diabetics. With the True Hearing benefits, your hearing aids has nice new perks, 60-day trial period. That was previously 45 days on your hearing aids. You get 80 batteries versus 48 batteries, and you get a 1-year unlimited post-purchase follow-up visit. That was previously 3 visits. And members will have fewer prior authorizations. This will help out a lot with anybody that has experienced any of this. So there's no prior authorization needed for diabetic shoes or inserts, non-emergent ambulance services, radio frequency catheter ablation for cardiac arrhythmia, and thyroidectomies. And they're adding prior authorization for that word I can't pronounce, but it's called droopy eyelids, okay? And additionally, members will no longer need to go through the Spine Center of Excellence protocol. So these benefits, when you get your annual notice of change, you're going to see these things that are highlighted in your annual notice of change. So if any of this pertains to you, please go back and review that. The Compass Edge Ideal and Dual Eligible, DSNP is dual Special Needs Program. Plan members now have expanded PAPA benefits. So also, as I go through these slides, I'm going to, they have several things on the changes with the dual eligible plans, and I am going to go through that pretty fast. But if you are a dual eligible person and have any questions, don't hesitate to ask us. I do have quite a few customers now on those dual eligible plans, but I'm going to go through those slides relatively quickly. All plans on PAPA now have PAPA concierge who will work with your clients engaged in PAPA to help find providers, schedule appointments, and help them navigate their benefits, close gaps in care, follow up to ensure members' needs are resolved. Plus, all PAPA members now have access to unlimited transportation within their set hours per month. So that benefit is only on the Compass, Edge, and Ideal, and then, of course, the dual eligible plan. So if you're on any of those plans, that's the new PAPA benefits. Again, I'm going to skip through this kind of fast. The dual eligible had some better transportation, better dental and personal emergency response services. There's another change they made was that all members will now have no cost post-discharge, will now have a no cost post-discharge meal delivery service. That's pretty awesome. Anticoagulant labs and palliative care and physicians visits. You get the 28 home delivered meals included post-inpatient stay on all plans up to 4 times per year. That's what the meal benefit is after post-discharge. You're going to have a 0 copay on the anticoagulant labs, and the palliative care physician visits give your clients freedom to talk to a provider about relieving the symptoms of stress in advance. So that's going to be a 0 copay. Now we're going to talk about, again, the more embedded benefits in detail. Again, embedded just simply means it's already part of your plan. You don't need to have do anything extra to have these benefits in your plan. So this is a big thing that they did this year. You're going to see that there's a lot more in the dental with your plans. So this is powered by Delta Dental. It's a robust network. I'm sure a lot of you realize that. If you ever have questions about what's the network with Delta Dental, it's the Advantage PPO and Premier Networks. So it's the Delta Dental Advantage PPO and Premier Networks that participate with this program out there. You get the same great 0 copay for preventive and comprehensive benefits, but now on the Ideal, Key, Edge, Vital, Medicare, Compass, they all include the brush biopsies now and 100% coverage of your panoramics every 2 years. So those are nice new benefits to those plans. And again, the dual eligible has much better benefits as well, similar to what was on the others, but I'll skip through this relatively quickly. And then Vision, that's iMed Vision. There's no changes to any of the existing plans. You get a 0 copay of routine vision, $100 of eye allowance, and the retinal imaging exam. But now up to $100 reimbursement for eyewear, $250 if you're enrolled in the optional enhanced dental and vision benefit, and we'll go through that a little bit later. You get up to $50 reimbursement for routine vision exam, up to $20 reimbursement for retinal imaging, and if you're submitting an iMed out-of-network claim, members will fill out the iMed claim form and submit via email, online, or by fax. Member will be issued reimbursement check 10-day processing time. So this is all out of network now. So we've had issues where people wanted to go to Costco for their vision exams, and maybe what's the other one? Honest Eyes on Front Street down there. So if you're going to a vision provider that does not participate with Priority Health, they realize that that is an issue, and so now you can do an out-of-network claim form, and this is what you will get on the out-of-network with the iMed under the iMed Vision plan. Okay, so always let us know if you have questions. We can show you how to get the claim form if you ever need it. So now your hearing is powered by True Hearing. Again, it's a 0 copay for your hearing exam, and then you have tiered copays on your hearing aids. That has not changed. That is a per ear, per hearing aid copay that you would pay. And of course, then it's depends on how expensive the hearing aids are to what your copay is. And then over-the-counter allowance. This has been around for the last couple of years. Unfortunately, though, I found out that a lot of people don't use this. And so there in the key plan, there was a change on regions 3 and 4. It did go down from $50 a quarter to $45, which I'm hearing is not too big of a deal when I explain that to people. But anyway, the over-the-counter allowance is powered by a company called Solutran. There's 3 different convenient ways to shop. You can go online via their mobile app. You can call in to order. You can use it at Walmart, CVS, Kroger, Walgreens. You can use your debit card there. There's a free 2-day shipping on all online orders, and there's a free shipping on all orders over $35 that include the over-the-counter items from Walmart.com. So if you order any extras, you get from Walmart.com only, you get free shipping on anything over $35. So now, because this slide starts to talk about regions, there's 5 regions in priority health. And so that you don't have a question on what region you fall in, I'm going to have Dawn go through and tell you the 5 different regions and what counties fall in that region. So if you just have a little notepad to jot down what your region is, we'd appreciate that. Okay, take it away, Dawn.
All right. So region 1 is Allegan County, Barry, Kent, Lenawe, and Ottawa County. Region 2 is Berrien, Calhoun, Cass, Ionia, Isabella, Kalamazoo, Mason, Midland, Missaukee, Montcalm, Muskegon, Newaygo, Oceana, Osceola, Otsego, St. Clair, Van Buren, and Wexford. Then region 3, I think this is where a lot of our clients are here, is Alcona, Antrim, Benzie, Charlevoix, Clare, Crawford, Grand Traverse, Hillsdale, Lake, Lapeer, Leelanau, Manistee, Mecosta, and Monroe. Then we go on to region 4, which is Alpena, Sheboygan, Eaton, Emmett, Gladwin, Gratiot, Iosco, Jackson, Kalkaska, Montmorency, Oscoda, Presqu'île, Roscommon, Sanilac, Shiawassee, and St. Joseph. And then region 5 is Aranac, Bay, Branch, Clinton, Genesee, Huron, Ingham, Livingston, Macomb, Oakland, Ogemaw, Saginaw, Tuscola, Washtenaw, and Wayne. So
all right.
I feel like I just announced all the schools that were closed in the area.
So there you go. So anyway, just a couple more things that I want to make sure I mention on this over-the-counter allowance is that it's a quarterly amount. It gets loaded on your debit card on the quarter, January, April, July, and October. And it is use it or lose it. So make sure you spend your money. And if you don't know what to spend it on, well, maybe you can get some stocking stuffers or something with those items. And then the last but not least, please do not throw away your card because it's going to be automatically loaded on the quarter. Some people think that you get a new card. You don't get a new card. It gets automatically loaded. And you will get new cards for 2022. I don't expect those to come out until mid-December. Okay, just so that you know when those will come out. All right. Again, on this over-the-counter allowance, you'll get a welcome packet with your OTC card and a catalog for after your enrollment or renewal. And again, I said that should come out mid-December. It's also available at Medicare.com, the catalog, or you can call the customer service number and get a new catalog if you need it. The customer service number, by the way, is on the back of your card, your Priority Health card. And again, a new card is not sent each quarter. So this is an example of what that card looks like. Please watch for it, and please don't throw it away because it's got some money on it there for you. Healthy food discount. Now, this is also with your over-the-counter card, and I haven't heard about a lot of people taking advantage of this, but just know that this is there. With the over-the-counter card, you can save on healthier food items through Walmart, CVS, Kroger, Walgreens, and more. You scan the over-the-counter card or the app on your phone at the checkout to take advantage of up to $2,500 a year in discounts on healthier food options, discounts on fresh produce, lean meats, yogurt, eggs, beans, whole grain breads, and more. And members can find new offers each Sunday through weekly emails, the website, and the Healthy Benefit Plus mobile app, or by calling Solutran's customer service. So again, this benefit is powered by Solutran. So if you have questions on any of these benefits, call the customer service at Solutran, which is going to be in your catalog, the phone numbers and everything in there. So, all right. And Papa Companion Care. That's in-person or virtual visits are powered by Papa. This connects Medicare Advantage members with college students, Papa Pals, who'd like assistance with things like household chores, transportation, which is now again unlimited, grocery shopping and light meal preparation, companionship, and technical setup and how-to. Sometimes I feel like I need that one for sure. But anyway, each plan over there on the Compass, Edge, Ideal, and Dual Eligible plan will show how many hours are available to you for the companion care. Keep in mind that this is per person, so each person gets this many hours. And if it's on your plan, I encourage you to take advantage of it if you need it. Silver Sneakers. This has been around since forever on Medicare Advantage plans. You've got robust at-home options with the over 100 on-demand classes designed for all abilities. Silver Sneakers Go Fitness app for additional workout ideas. You've got educational videos on topics like fitness, motivation, nutrition, and overall well-being, and fitness kits, toning, strength, yoga, and walking. So tap into those for your Silver Sneakers fitness benefit like that. Also, you have 480 facilities in Michigan, 16,000 nationwide. You can find a location that participates with Silver Sneakers at silversneakers.com. You can gym hop. So what that means is that if you have a Planet Fitness here and a Planet Fitness in Florida or Arizona, someplace like that, you're still in your Silver Sneakers membership, and you can utilize it in those areas. And then this last benefit, it's there. It's a College Save Rewards program, earn in person or virtually. I have never heard of anybody taking advantage of it, but just know that it's there. And if you had questions, I would have to point you towards Silver Sneakers to totally answer those questions, because as I said, I've never heard of anybody taking advantage of this benefit. Acupuncture, that came out a couple years ago. It's a $20 copay per session. You get up to 20 Medicare covered sessions for chronic lower back pain, plus 6 non-Medicare covered sessions for other conditions such as the chronic pain, anxiety, headaches, and chemo side effects. So they added on the extra acupuncture like that. All right. Free to Talk Physical. I love this, and I know this works. It's truly a 0 annual physical exam or annual wellness visit with no hidden fees when your clients discuss things that fall outside of what's included in these visits. So there's no worry about having your doctor code extra things in there and charging you for it, because it's all covered under this Free to Talk visit. It's a $90 flat fee for observation. And that's another thing that you want to be aware of in these plans, is that you only pay $90 at the emergency room even if you're held overnight for observation, and all services and tests are rendered, and that's included in that $90 copay. So I always like to make sure people know that the observation is not a Medicare benefit. And so therefore, if people have the Medigap plans along with the Medicare, the original Medicare, then that is not a Medicare benefit in those plans. And I've seen people get caught with being held overnight for observation and having to pay for that whole thing. But just know that your Advantage plan covers it. And these are all reasons why we call these Advantage plans, because there's so many advantages in there. Here's your post-discharge meal delivery service. This is powered by Mom's Meals, eligible to anyone following an inpatient discharge from an acute hospital or psychiatric hospital or skilled nursing facility. You get up to 28 meals, 2 meals a day, up to 4 times per year, and included on all plans, including the dual eligible plan. And incidentally, you want to remember that things like these services, you do want to go through Mom's Meals for these services, like the PAPA benefits. You do want to go through PAPA for those benefits. That the information is in your how to connect with those are in your plan details when you receive them. But you do want to use those services. So if you just hired whoever meal service out there, that would not be covered unless it was on the Mom's Meals list. Transportation, and this is on dual eligible. There's more transportation benefits. And this is also on the dual eligible plan, the personal emergency response benefit. So I'll kind of skip through these fast, like I said before. Out-of-state travel pass. So visitor travel benefit allows members to reside outside of Michigan for up to 12 months. I've actually had that question a couple of times in the last few weeks. So you can reside outside the state of Michigan for up to 12 months. And if it's after the 12 months, then they would be asking you to change your plan to that state, okay? Members pay in-network copays, coinsurance at out-of-network Medicare participating providers in all states. Now it says except Michigan. The reason why it says that is because in Michigan, at the beginning I said, Priority Health's doctor network and hospital network is second to none over all the other carriers. So just what it is that Michigan has, with Priority Health, has the Priority Health doctor network that you utilize, okay? And then out of the state of Michigan, it's any Medicare doctor in the United States that's in your doctor network. So that's why it says except Michigan. Don't let that be alarming. You have better access to Medicare providers in all states. Through their partnership with MultiPlan. It's going to say MultiPlan on your card. So if out of state, anybody asks any questions, they're going to see that MultiPlan. Members are not limited to the MultiPlan providers, and they can still get services from any Medicare participating provider. So what this means is you've got 2 accesses to out-of-state benefits, one through the MultiPlan and also through any Medicare doctor in the United States. The providers must submit the claim form to Priority Health, and there's, again, the MultiPlan logo on the back of your card as well. So I get this question quite a bit. And what if they say priority who when you show up at a doctor's office, okay? So what I encourage you to do is get them to call Priority Health customer service. And I know that there is a whole team of people at Priority Health that will make sure that that claim is seamless to you. So if you have any issues with that, that's what I'm going to encourage you to do. But of course, the customer service at Priority Health is awesome at answering those questions as well. But I know there's a whole team of people at Priority Health that makes this benefit seamless to you. Assist America. This is an amazing travel accident policy. You have emergency travel assistance when you're traveling more than 100 miles away from home. It's available everywhere in the world, 24 hours a day, 365 days a year. The benefit will connect members to doctors, hospitals, pharmacies, and other services if you experience a travel emergency. There's no exclusions for any pre-existing conditions or extreme sports hazards, hobbies, that kind of thing. And again, it's always for anyone over 100 miles away from home. All right. It also includes emergency evacuation or transportation to the nearest facility capable of providing proper care. Round trip transportation for a family member or friend to be with the member if expected to be hospitalized for more than 7 days while traveling alone. So you always think about the what ifs when you're traveling alone and you end up in the hospital with a major whatever surgery. Well, this will pay for an airline ticket for someone to be with you in that emergency. It will help replacing lost or forgotten prescriptions and retrieval of vehicles or other valuable property left stranded because of a medical situation. So always study up on that policy if you're traveling because it's an awesome benefit. Okay, now we're going to go into the virtual visits. Due to COVID, this has been a very popular benefit as well. It's a zero copay for in-network visits on all plans. And it says they're including the Vital plan. It wasn't there last year or for 2021, it wasn't on the Vital plan. But all plans now have a zero copay for in-network visits. You can talk to your primary care provider, a specialist, a behavioral health specialist. You can schedule a visit with any in-network provider or out-of-network provider outside the state of Michigan under the out-of-state travel benefit like we described before. You have a 24/7 access through Spectrum Health Now to get needed care anytime, anywhere. Use a phone, tablet, or computer to connect with your provider and conveniently schedule and access virtual care through the Priority Health app. So those are the ways that you can access the virtual care. My Strength, this was a benefit they added, I think this was last year. It's continuing to offer because 1 in 4 adults ages 65 and older experience mental health problems. And it's free access to online mental health wellness tools. You can see the things there to manage depression, reduce stress, improve mood, sleep better, find daily inspiration, and they can opt into to having a dedicated one-on-one coach while you're going through the program. So, and there's already over 1,400 self-directed activities. So that's a benefit, again, that they added last year that's valuable to anyone that would need that. And then the Brain HQ came on board last year, a personal gym for your brain. 29 online exercises that will help with attention, brain speed, memory, people skills, navigation, and intelligence. So it can be accessed through your computer, tablet, or smartphone. Research shows by using Brain HQ, people see less depression and more happy days, improved focus, 48% fewer at-fault car crashes, 135% faster auditory processing, and better self-rated health. So those are good things to ward off dementia. All right, now we're going to go through some more plan details here. All the plans are the same names as what they already had before. There's 3 HMO point of service benefits, the dual eligible, and then the PPO benefits. So again, on the key plan, this is the one that had the best enhancements. It's still zero premium. Anything that you see there that's highlighted, there was a change. So here on regions 1, 2, and 5, it's now a zero copay for your doctor visit. It stayed at $10 for regions 3 and 4. You can see where they changed the copay for the palliative care visits and the anticoagulant labs. And on regions 1, 2, and 5, the out-of-pocket maximum is $5,000, and on 3 and 4, it's $5,300 or $5,500, excuse me. And then a big thing that I know is going to help a lot of you is that there's no prescription drug deductible any longer on tiers 3 through 5. There was a drug $100 on tiers 3 through 5, which is your brand name drugs and higher. But next year there's no deductible on those tiers. So that's a nice added benefit. Edge plan. I love this plan. This is probably overall my favorite, but a lot of people here in our area don't, it's not in our county, not in Grand Traverse County. So Edge plan, there was really no changes on this one except for the palliative care visit and the lab tests going to 0. So on the palliative lab tests. So otherwise, there's no changes to the Edge plan. Compass plan, again, there's only the changes to the palliative care. And then again, on Compass plan, just like the Key plan, there's no deductible on your tiers 3 through 5 prescription drugs. So that will help you a lot. Vital, I don't have, this isn't available in Grand Traverse County, so I don't have anybody on this plan at all that I know about, but there was a little bit of a change on the out-of-pocket maximum, or quite a bit of a change actually on the out-of-pocket maximum. And virtual visits, of course, are now 0 copay, like we mentioned before. Ideal. Okay, so this plan, everybody I think is going to be the same price next year, $24 a month. I'm pretty sure. Dawn, can you confirm that for me? I'm pretty sure everybody's going to be $24 a month on this plan. So, but it changed up the palliative care, and then there's no other changes on that. But I'm pretty sure that's going to be 24 on everybody. Do you see that, Dawn? Yes, I'm right. Good. Thank you. So I think that comes down $1 for some of you. Value plan. Now this plan, I kind of looked, I like this plan. However, I would only encourage people that live in the Grand Rapids area to maybe look at it, because when we see how this is priced now in comparison to like the Key or maybe the Compass plan, or even maybe the Ideal plan, I would say if you're in the Grand Rapids area, it might be a good plan to look at. But up here in Northern Michigan, it's priced kind of high. And so I'm encouraging people to take a hard look at that and maybe look at especially the Key or the Compass plan instead of the Value plan. But again, just those couple minor changes on that. Merit. Now, if you're going forward, the Merit, the Medicare, and the Select plan, these are all what we call grandfathered plans. In other words, they're not actively promoting them. You can keep these plans, but just know that if I were on one of these plans, I'd take a hard look at the plan I'm on, and I'd say, maybe I should look at that Key or Compass plan, or maybe even Ideal plan, because price-wise, as I do the pricing out on these plans, I don't think it's worth it for you to be on the Merit, the Medicare, or the Select plan. So you can always let us know if you have questions on that, and I'll coach you on what to do with that. But there was no major changes on the Merit plan. And if you're on the Medicare plan, I know I have a lot less people on the Medicare plan than the Merit plan, but there was just a couple of minor changes on that. And then on the Select plan, and again, if you're on any of those plans, take a hard look at them, because those plans are quite pricey, and I see no reason why you need to pay those extra premiums. Dual eligible, this is just going over the changes to their plan. And also the dental for dual eligible plans. And now we're going to go through the premiums. So this map shows the regions of the state and what plans are in what region. Okay, so if you jotted down the region that you're in, you can see what plans are available in what regions. This is where I was right on the Ideal plan. Everybody is $24 a month. Let's see, the Compass plan is 0, the Edge plan is 0, and the Key plan is 0. So if you fall into any one of these 3 categories, Key, Edge, or Compass, and you're on even an Ideal plan, I'd take a hard look at possibly moving to one of the 0 premium plans, because as I go back and forth and look at the numbers, I think that those 0 premium plans are so worth it. So, okay. All right, pharmacy benefits. Now now this is a big one. Insulin coverage in the gap on the value and the key plans. I mentioned this before. So what that basically means is that you're going to pay copays through the coverage gap on your insulins, certain insulins. And there is a list of what exactly insulins those are, but instead of having to pay what you have to pay in the coverage gap. So that's a big deal on the key and the value plan. There's, again, a zero deductible on the Priority Medicare Key and Compass plan. We already talked about that. That's on the tiers 3 through 5 drugs. Zero mail order on 90-day supply of tiers 1 and 2 on all plans. So no matter what plan you're on, you can use the mail order. If you have questions on the mail order, it should be in your plan materials. That's done through Express Scripts. That's the name of the pharmacy. And you can get 90 days at a time on tiers 1 and 2 for zero copay. And you have access to national pharmacy networks. Okay, the enhanced dental and vision. So these are the changes. Remember I said before that the prices have come down. Last year, the prices were $36, I think it was, on the value plan, $37 on everybody else. So on the key plan only, it's a 40% reduction, $23. So it goes down from 37 to 23 for the enhanced dental and vision plan. So they poured a lot of money, more money into the dental and vision, which is wonderful. Again, you get a zero copay for your fillings and composite resin. So if you have just the key plan, what that means is that on the key plan itself, already embedded in there is 50% coverage on your fillings and crown repairs, okay? And there's no limit on that. If you buy the rider, now that filling 50/50 goes down to a zero copay. So if you buy the rider, you have no extra copay at all on the fillings, okay, and all these other benefits that you see there with the crown repairs and such. Zero copay for fluoride treatment. That's new this year. You get 50% coverage on restorative endodontics, crowns, relines, and repairs and simple extractions. 50% coverage on oral surgery. It was 30% last for 2021. And 50% coverage on implants and implant-related services or repairs to the tooth. $2,500 annual limit. That's huge. It went from $1,500 for 21 to $2,500 or $2,500 in 2022. So what that means for you is that you can get a couple of crowns next year if you need them. So, but still you have to pay the other 50%. So don't forget about that part. Now back to over here to the merit, or excuse me, the value of the merit, the Priority Medicare, the Select Ideal, and the Vital plans, and Compass and Edge, their rates are going to be $29 a month. All right, that's a 20% reduction from the $37 that it was for 2021. And again, it's a zero copay for the composite resin that you pay nothing for your fillings. For example, there you get the fluoride treatment, you get the 50% coverage on your crowns, root canals, etc., and also on the oral surgery, 50% coverage on your implants, and you also get the $2,500 annual limit. So just a little bit more differentiation between the plans this for 2022 and the additional dental and vision rider. And then of course, when you buy this rider, you automatically get the extra $150 of eyewear right along with it. It's a package deal. So on the other part of the plan embedded, there was automatically $100 of eyewear. Over here, there's $150, so you've got $250 of eyewear. Okay, we are done. That is it. That's my story for today. And Dawn, do we have any questions? And I'll let you answer the questions and fill in as I need, okay?
We have quite a few questions.
Yay.
I saw some of these come in prior to you answering it, so you may have answered some of these questions. But Diane asks, do we need a card to use the over-the-counter allowance? Yes. If so, which one and when do we get it? So Diane, you would have seen the picture on one of those slides of what that card looks like. But yes, you do need the over-the-counter allowance. And again, you can go online to order the products. You can call on the phone, or you can shop in Walmart and some of those other stores. However, be very careful. because it's very specific of which product they will cover through that over-the-counter. So, if it's Tylenol, it has to be, that strength and this many count in the bottle. So, so I think it's an easier thing to just call on the phone or go online, use that over-the-counter debit card that they will send sometime in December, and they ship it for free. So it's really nice.
And if you go into a store, take your catalog with you, because it will tell you the specifics on what all of that is, so you can match it up with this product that you're buying at the store.
Yeah, perfect. And then Joyce says she lives in Holland and noticed that Rite Aid is offering Priority, which is the drugstore she uses. She said she's struggling with seeing what she's typing on the screen. So referring to the over-the-counter, she sees that Rite Aid is offering Priority. I'm not sure what that would be in reference to.
That may be in reference to the over-the-counter card. I think I know who Joyce is in Holland.
Yep, you do.
And I will get back with you on that, because it could be what they're offering is to be able to use that over-the-counter card there. We've always been told it's Walgreens, Walmart, CVS, and Kroger, but maybe that's been an added thing with Rite Aid in Holland area. Okay.
Yep, that makes sense. And then Diane asks, how well is the shingles vaccine covered under the Key plan? Now, it's my understanding that the flu shot is covered in full, given at your doctor's office or the pharmacy, but the shingles shot is, if you find a pharmacy, it falls under the pharmacy Part D rules. Is that correct, Laverna?
Correct. And it's a tier 3 drug. So like on the Key plan, I'm pretty sure it's a $42 copay.
So you'd want to go to a preferred pharmacy to have that done, like Meijer, Walgreens, one of the preferred pharmacies.
Right.
Colleen says, can we get the YMCA in Traverse City to be included in Silver Sneakers? We go to the YMCA under the plan in Tucson. Now, I've had this question before, and I've been told that if enough people pester Silver Sneakers and ask for a certain gym to be included, they look at those seriously. So if you all bombard Silver Sneakers and say we want YMCA in Traverse City to be covered, they might take a hard look at it, but they will accept recommendations. Diane also asks what kind of coverage is offered overseas, and I saw that question come in before you hit that worldwide travel assistance, Laverna. So hopefully, Diane, that answered a lot of your questions. But yeah, Priority is second to none as far as worldwide travel coverage is concerned, and offers a lot of benefits through that worldwide travel.
And always remember that it's emergency, urgent care, and ambulance worldwide with the foreign travel. Okay, you can't go over to Germany and get an annual physical. Okay, so it's always just the emergency, urgent care, and ambulance on any Medicare plan like this.
Right. George says, do we have to use a priority plan doctor in Michigan as opposed to any Medicare doctor? The answer to that would be yes. You have to find a doctor who accepts priority here in Michigan, but again, the network is robust, so shouldn't be too much of an issue to find a doctor in Michigan that accepts priority health.
Right. And incidentally, I'll just insert this in there too. On the HMO point of service plans, you do need to name your primary care doctor. Okay, so that would be like on the Key plan, for example. But with the PPO plans, you do not need to name the primary care doctor. And what that tells Priority Health, if you don't name a primary care doctor, is that they don't know where you're going to go get your annual physical at. So it could be another Medicare doctor somewhere else in the United States. So just be aware of that. And we do encourage you to use a primary care doctor, because it's proven that if you use a primary care doctor, it helps control costs, yours and theirs. Okay.
George also asks, does a virtual visit connect you with your doctor or just their PA or assistant? Who determines this?
I'm not sure on that one. I'm pretty sure with the virtual visits, you have to go through the Spectrum partners. Okay. That's consult your annual notice of change. It should describe the virtual visits in there. And then I know it's done through the Spectrum partners. Okay. So that's what I would encourage you to do is look at that in your annual notice of change. I hope that's going to answer your question.
And then Beth asks, does the out-of-state network include the Mayo Clinic?
Yes.
They accept Medicare, so that falls into that guideline of once you're out of the state of Michigan, you can see any doctor that accepts Medicare.
Correct. And incidentally, I know I'm pretty sure the Rochester Mayo Clinic does not accept Medicare. However, I know that Priority Health has agreed to pay those as in-network as well. Okay, so just be aware of that.
Brooke has a question. I'm on a Medigap Plan G. Where do I fit in here? Great question, Brooke. I think right along with all of the other plans that Laverna talked about, if you're paying a premium, I think it's time to take a really hard look at some of these other plans that are available out there. Depending on your circumstances and what's going on medically with you, it may be a good idea to take a look at an Advantage plan. They've made a bunch of leaps and changes forward in the last several years, and the conversation may look much different than when you originally enrolled into that Medigap Plan G. And keep in mind with that Medigap Plan G, you don't have the dental, you don't have the vision, you don't have the prescription, you don't have all of these other benefits that Laverna talked about here today. So I would encourage you to talk to one of us and look at the pros and cons of staying on that Medigap plan.
Absolutely.
George, will copies of your slides be available as a PDF?
I'm going to have to say no because they are properties of Priority Health. However, we are willing to email our webinar because we're the ones that are doing that. Like Dawn said at the beginning, it's being recorded, so our plan is to email the webinar out to you. Okay?
So you kind of have a sneaky way of getting the slides that way.
Sort of, maybe. Okay.
Sort of, maybe, yeah. So, John and Julie says, can you go over the acupuncture slides again? I don't know if you can find that right away here, Laverna, but I do know as of 2 years ago, they added acupuncture to their plans for lower back pain. And this year they changed it to other items too. So she's scrolling back there. We'll see if we can get that pulled up for you.
There you go.
There it is.
Okay, so again, it's $20 copay per session. You get up to 20 Medicare covered sessions for chronic low back pain. Always remember that's for lower back pain, the 20. Plus you get 6 non-Medicare covered sessions for other conditions such as the ones listed there. Okay?
Okay, and then Jim asks, is there any foresight on Priority Health expanding the eligible stores taking the over-the-counter benefit? For example, Meijer. Not that I've heard of, but
not yet, but I wouldn't be surprised down the road.
Okay, yeah. So nothing as of now, Jim. But again, going online or calling on the phone with that over the benefit card, I've heard is so easy, and they deliver for free right to your door. So yeah, nice benefit there. Teresa asks, is there a hard copy comparison chart so we can review and select the appropriate plan? So we do have online versions that we can email to you that is kind of the comparisons of all the plans there. We have limited supplies of hard copies. With the pandemic and everything that has gone on around us, they are really forcing our hand to do everything virtually. So we can certainly email you a copy of the comparison chart, but if for some reason that's not working for you, let us know and we'll see what we can do as far as getting a hard copy. Jim says, been hearing off the street that some insurance companies are now declining to cover COVID hospital stays. Is this true?
No. Okay.
There's no street cred there.
No. What you might have heard is earlier when COVID came out, there was some plans that may have covered the hospital stays with no copay or limited copays. Okay. However, that has changed again because of all the COVID rules, and you pay just your inpatient hospital copay. And remember that you're always capped at 5 or 6 copays, depending on how long you're there. Okay.
All right. Carrie says, do I have to send a DDS bill to priority? Haven't been reimbursed for dental surgery.
Okay, so my brain is racing on that question. So the question would be, was it dental surgery that was covered in the dentist office by your dentist that you submitted, or is it a situation where your dentist didn't participate with Delta Dental? I've got too many questions.
I would say, why don't you email Laverna or myself? I'm going to put our email addresses and phone numbers here in the chat for you all to see, but that I think would be something that we'd want to deal with on a individual basis.
Yeah, and it also would depend on if it was a medically necessary oral surgery. Those would not be under your dental services, but under your medical benefits under on these Advantage plans. So just too many questions on all of that for us.
Yeah.
Okay.
Yeah. Let me get back here. Boy, you guys have a lot of questions today. This is fantastic. Andrew says, do you recommend signing up for the enhanced dental and vision? It is optional for a reason, but I think it's well worth the $23 or $9 this year.
Yeah.
When you get all that coverage on dental and vision, I
think it's very well worth it.
Me too. Carrie says, what does zero premium mean? Take it away, Laverna.
Zero premium. You don't pay anything for the Key Edge, Vital, or Compass plans. So, and then the next question people will ask me, okay, how can an insurance company do it for zero premium? Well, the answer is that don't let your politicians fool you. Medicare is an extremely well-funded vehicle. So you've paid in Medicare taxes over the years. Your employers have paid Medicare taxes over the years. You're still paying Medicare out of Social Security checks or possibly directly to the government. So millions and millions of people are doing this. So it's an extremely well-funded vehicle. Medicare is funding these programs, and these programs are graded by how well they perform. Priority Health as a company, and you'll see, is rated 4 to 4.5 stars consistently. So what that means is, and 5 stars is perfect. So 5 stars is very hard to get to be perfect out there. So, but with their gradings, that star rating, 4 to 4.5 stars, that means they're getting great reimbursements from Medicare to fund these programs. And then what they have to in turn do is pass the benefits on to you through these extra programs like the extra dental, the vision, the silver sneakers, and so on. Okay.
All right. Pat asks, do anesthesiologists take priority?
Oh,
they do. Yep. George says, are the overseas travel medical benefits comparable to the optional medical insurance you can buy when you book a trip?
I would compare them yourself, because I don't know what what your travel accident policy is going to do with your airline, so I will never venture to say that it will compare with it. What I would do is take a look at what your airlines or your travel agent is offering you, and then compare it with your Assist America benefits, and then you decide. Okay?
All right, the next question here is, where online do I sign up for the enhanced dental for my key plan? I have a link that I can send you to sign up for that dental plan for the key. So if you guys, you'll see my email. I made a mistake on Laverna's email. I put .com, it's .net. So I corrected that, but you can email either of us, and but specifically on this one, signing up for the enhanced dental, I can send you a link so you can do that directly online. Next question, getting mail from eHealth. Do you know anything about it?
eHealth.
Most likely it's just junk mail.
Yeah, it's probably their advertising similar to what they do on television and such. Their Medicare Advantage plans. And like I said in the beginning, you want to be really careful because, again, you could very well pick out a plan that doesn't work well here in Northern Michigan, nor that will offer any Medicare doctor in the United States as your network of providers.
That's right. Colleen has a follow-up to the Silver Sneakers Traverse City YMCA. She said, just select contact us at the bottom of the Silver Sneakers website. Send an easy email asking about TC YMCA to be added to the plan. Everybody's help is appreciated.
Yay!
Good job, Colleen. Janice says, under additional benefits, is chiropractic going to be the same as going to a DO for an adjustment? Does the doctor need to be labeled a chiropractor?
No, DOs are going to be considered a doctor on copay. Chiropractic doctors are going to be considered a chiropractic copay.
Janice says, can the enhanced dental vision be picked up at any time during the year or only during sign-up time? Yeah, go for it.
Yeah, it's right now you can pick up the extra dental and vision starting January 1st. And Priority Health, though, has been always lenient with this, where they will give you the first 60 days of the new year to sign up for it. But if you signed up for it, like say January 15th, it's not going to be effective until February 1st, for example. And after that, you're not going to have the opportunity again until the enrollment for next year.
Jim says, when traveling, do we need to notify Priority Health when and where we would be traveling? Should medical care be needed during my travel?
No. Yeah, you just want to make sure you've got that Assist America handy in case something happened, that you know where there's phone numbers are and everything, and just always remember that the benefit is there because a lot of people don't remember that.
Pat Kellogg says, thank you, ladies. You're welcome, Pat. Kathy says, if we had enhanced dental coverage last year and we have received our new cards already, do we have to do anything to be sure that we have enhanced dental coverage again? No. If you had it last year, you haven't done anything to your plan, it's just going to continue on everything as is. So it looks like we are to the end of our questions. So we will stick around here for a little bit longer if any further questions come in, but do see there that I posted both of our email addresses. If you have questions, certainly let us know. If you want to change your plan, you can let us know and we'll send you a link to change your plan online if you're the tech savvy person. Or you can just call that phone number on the back of your priority card. And Laverna, you had some specific days, didn't you, that it's easier to get a hold of priority?
Yeah, and we have a form that we can send you that will give step-by-steps on how to work with the link that we email you, and also calling Priority Health customer service number on the back of your card if you choose to change your plan that way. Yes, I've been told that if you call Priority Health to change your card, the best times to call are Wednesday afternoon, Thursday, or Friday. early in the week is slammed. Okay.
But yeah, there's also, for the tech savvy, there's a link that you can just go right online and switch from a vital plan to a key plan or things like that. If you're the Medigap person, you would need to contact us to review that and possibly get into an Advantage plan. So this would just be from changing the plans that Laverna talked about. So if there are, oh, let's see, we just have a bunch of thank yous. Here's a question. If you picked up Enhanced, how is that billed? That's directly through Priority Health.
Mm-hmm. Mm-hmm.
So whether you have if you have your account set up so it's a direct pull from your bank account, it'll come right from there. Otherwise, you'll get a paper bill for that Enhanced Dental Vision.
And they will take credit cards now too. So.
Oh, that's right. Yeah. Norval, we are not going to have another one of these online meetings scheduled. This is the last one of the Medicare season. However, we are recording this session, and so we can send you the recording of today's session. Colleen, if you could email me directly, and then I can respond with that link for the Enhanced Dental and Vision. That would be helpful, so I have your email address.
Yes, so just to kind of cover that one more time is that if you want to change your plan, we will email you a link to change your plan, as well as step-by-step instructions. So that's the number one way that we want you to change your plan, if you can do it that way. If you absolutely cannot do it through the link, we will also include in there step-by-step instructions of how and when to call Priority Health customer service. Okay?
And Shelley, very good emphasis here. You said if you don't want to change, you don't need to do anything at all. That is correct. If you don't need any changes to your plan, you are good to go. 2022, here we come. You're set. So, yep, no changes, no need to do anything. All right. Well, it looks like we are to the end of it here. Let's see what this is. I see a hand raised from Judith Mallory. Okay, looks like Judith, if you do have a question, if you could type it in the chat bar there, I'll stick around here a little bit longer to see if you could do that. It's the little bubble at the top.
Yeah, and Judy, if you have a question, you can always email me. I'll answer you back as soon as possible.
Jim Hodick says he has one more question. Go for it, Jim. Oh, time's up, Jim. Sorry. No, I'm just kidding. Okay, Jim, have you heard anything further about Medicare age going down to age 60 versus 65?
There's always rumblings, but nothing definitive. So, I mean, the government's always looking at that, but, and I've seen stuff across our publications, saying that and everything, and that they're always talking about it, but until something's actually done, I'm not getting excited about it. So.
All right, I'm going to type Laverna's email in here one more time. Whitcop, FordInsurance.net. So Mary, you should see that link there. You can just copy that and email her. Or I can just give you Laverna's home address and you can just knock at her door.
No, thank you. Although I know a lot of you know where to find me. So I've kind of lived here for a long time. So anyway.
Where is your email shown on the screen? I'm typing it into the chat here, Teresa. So you'll see Laverna's. I'll retype mine in here as well. It's D McConnell at fordinsurance.net. Wes says we had dental, etc. coverage on our card. New card does not have it. Wes, why don't you email Laverna or myself and we'll look into your plan and just make sure that it's still there.
Yep.
Now, if you didn't make any changes, nothing should have changed.
Exactly.
So,
it just might not state that it's there on the new cards. I haven't seen the new cards yet.
If you email me, I can look that up and email you back the answer. All right. Well, hopefully we have answered all of your questions. You have our emails. You know how to get a hold of us. If anything else comes up, we can certainly steer you in the right direction. It's been a great time together today. Lots of great questions, and
yeah,
like it was a good time here. So.
All right. Thank you so much, everyone, for doing this. And we really appreciate you doing this today. And again, you know where to find us. We're happy to answer your questions and get you going for your Medicare plans for next year. Okay. Thanks so much.
All right. Goodbye, everybody.
Bye-bye.